Hi everyone, welcome to my Sunday session. Today is COVID-19, its vaccines with cancer patients, and I have with me a clinical oncologist, Dr. Mastura, to join us. Hang on, let me just check if I can add her in. There was a little bit of issue letting her join in. Just a minute. All right, guys, thank you for joining. I'm trying to add Dr. Mastura into the live. Just give me a few minutes. Excellent.
So sorry.
Hi, Dr. Mastura.
I'm just
No
so
problem.
not savvy.
You wanna change the camera to the other way?
Sure.
You're horizontal at the moment. Excellent. Hi. Oh, I can't hear you. I can't hear you. You've pressed the mute button. Dr. Mastura, you're on mute. Yes.
No, I'm not. Okay. It's just
Okay.
a bit lambat.
Now I can hear you. Oh, I see. Okay. Thank you so much, Dr. Mastura, for joining us on a Sunday evening, taking your time out from dinner and Father's Day celebrations to ease all our worries and reassure all of us who have friends and family who are cancer survivors or who are undergoing cancer at chemotherapy at the moment. So thank you so much for joining us tonight. I know I've introduced you a little bit, but would you like to tell everybody who you are and what you do?
Okay, hi everyone. I'm Dr. Mastura Muhammad Yusof. I'm a consultant oncologist at a few private hospitals, Pantai Hospital Kuala Lumpur, as well as Subanjaya Medical Center. So I've been doing this field for about nearly 20 years now. I like it very much, and I'm here to actually answer any questions that you have about cancer as well as the COVID vaccination. Thanks for having me, and thanks Rakhee for the invitation.
You're most welcome, and I'm so happy you accepted the invitation. Hi, everybody who's just joined us. Feel free to ask us questions. On the right bottom corner, there's a little bubble that has a question mark sign. So put in your questions into there, because on the chat channel, it tends to go missing when new people join the chat. So if you have any questions for Dr. Mastura or myself, put it into the question box after that. So Dr. Mastura, I'll get straight right into it. How can COVID-19 infections affect cancer patients?
Okay, we know that in Malaysia, our cancer patients are very important because a lot of patients are affected by cancer. And we have to look at it in three different aspects. That is, one is the cancer per se. Most of our patients come in or are diagnosed with not early cancers. They usually have locally advanced cancer. So we are talking about cancer of the breast, colon, lung, as well as stomach or liver. These are the common cancers in Malaysia. So that's one. So when they have cancers who are locally advanced, then they have to be treated with multiple treatment. And this treatment gives them side effects, and therefore they are at risk of getting some issues or events. Second is actually the patient factor. So patients who develop, age population or older patients, they are also probably more overweight. They may have some problems like smoking, and they have comorbidities, means that they have some other pre-existing conditions, hypertension, diabetes, and so on and so forth. And the third thing is actually the treatment that they are going to have for their cancer. So when you have all these three combined, then what do you have? You have disaster, okay? So when you have these three and they get the infection, then it's going to be disastrous. Okay, so what happened when cancer patients get the COVID infection? Then they are more likely to have more severe symptoms. They are more likely to have more severe illness. That means they are more likely to be hospitalized. They're more likely to be ventilated, and of course, the case fatality rate, means the death rate from out of all the COVID positive patients, is going to be high. And this has been proven in a lot of studies they have done. So patients who have lung cancer, hematological cancer, and solid cancers, they are at higher risk of all these morbid event because of the infection. That's why we need to cover ourselves by taking the vaccines. It's very important. Okay.
Excellent, excellent. So they're basically on the high risk category. So even though they may be immunocompromised, cancer patients are high risk to get severe COVID-19, as well as on the high side of, I mean, the risk of them dying is much more higher than the general population. So that's what you're basically trying to say. So we have a lot of patients who are undergoing chemo or radiotherapy. So can these patients have the vaccine? Can they take the vaccine?
Okay, so if you look at the latest guideline from the NCCN, it basically clearly states that patients who are on treatment or patients who have active disease, these are the patients that is of a priority to actually take the vaccine, because they are the people within the cancer group that are most susceptible to all these complications that we just mentioned. So patients who are on chemotherapy means they are on treatment. So we're not talking about just chemotherapy. It can be chemotherapy, immunotherapy, radiotherapy, targeted therapy, or all these treatment in combination. So they need to be prioritized in terms of getting the vaccine. So they can have the vaccines. Just make sure that the timing is nice, and they have to get it as soon as it's available to them.
Because I think there's a bit of confusion when some of their oncologists in different hospitals say that, oh, you have to complete your chemotherapy and then wait a few months before they can get the vaccine. So I know a couple of people who have actually been turned back from the vaccination center because they're still undergoing active chemotherapy. So I guess that's where the confusion arises for some of these patients. So what is your advice to them?
I think this stems from the fact that last year we have this gap in our knowledge about vaccines, about cancer and the infection. So because in that knowledge, that to complete your chemotherapy before you get the vaccine. So now we have evolved because we have more data. So we have more data that shows that, I mean, this data came from studies that were performed in just cancer patients. So we have studied in Israel, we have studied in New York that performed this vaccination in people who are actually undergoing chemotherapy, and they find that it is not just safe, but it also results in 70 to 90% of the patients getting a positive antibody response. So because of that, we know that, yes, we can do it. So I know that there's a guideline, but it's just a guide, and we have to be cognizant that that is just a guide. So the gap of the knowledge is going to be, it's going to be filled as we are going along. So we have to be updated, I would say. So for my patients, or for patients who are out there who's trying to get the vaccines while they're having chemotherapy, I would say go for it, because I guess we have to be up to date.
Okay, I have a question from one of the followers at the moment, from Jahangir. Is there any contraindication for patients on active chemotherapy treatment in getting vaccination? So are there any specific contraindications, like if they're going for this particular chemotherapy, they definitely have to wait, or what is your advice to them?
Okay, so we know that most chemotherapy regimens, you don't have to wait, except for the group of people who are undergoing a very immunosuppressive regimen. So these are usually hematological cancers, so they should get the advice from their own doctors about whether they should wait or not. All patients who are receiving stem cell transplant procedures, or those who are having CAR T cell treatment. So these are the patients whom, before they embark on this treatment, they should go for the vaccination before. And there are also another group of patients who are having the B cell directed therapy. So these are like therapies like rituximab. So this therapy basically targets the B cell, the exact cell that is producing the antibody. So these are the patients that should not get the treatment. Another group of patients, I would say, are those patients who are severely immunocompromised because of their disease, or because of the the treatment per se. But I would say in solid cancers, the cancers that I'm managing, not many patients are within that group. So it's pretty safe to actually have it.
Excellent, excellent. So now that brings us to the next question, which is what is a safe vaccine for them to get? Because we know that we have a few vaccines out in the market in Malaysia at the moment, the Pfizer, Sinovac, the AZ, and now soon to come in as well is the Johnson Johnson as well as the Sinopharm, the CanSino Bio, sorry. So which would be the safest vaccine for them? Because we know most studies were actually done for Pfizer. So is it safe for cancer patients to get any of the other vaccines? And would they mount adequate antibody responses with these vaccines?
Okay, I think we have to go back to the fact that when all of us actually received Pfizer vaccine, there was no study in cancer patients. Okay, then subsequently we have more studies using Pfizer as well as AZ in cancer patients per se. So there has never been any head-to-head comparison between the vaccines within the cancer patient population. So we don't have any clue as to which one is more effective or which one is safer. So we don't know that. So that's one. Number two is the 3 vaccines that we have at the moment in Malaysia, and perhaps we're going to soon we're getting the Johnson and Johnson vaccine, right? All these vaccines have been shown to be safe in people who are above 18, and for Pfizer is above 12. So I guess for patients who have cancer and they are between 12 to 18, then they shouldn't get the other vaccines, but just Pfizer for them. But the other 3 vaccines, I would say that they are safe and effective for all cancer patients. And there have been also studies with patients with Sinovac in Sao Paulo, in some other countries, which have shown that it is actually as effective in cancer patients also. So there's small studies that you can actually just, extrapolate, I would say, because we have been extrapolating anyway. So we are learning as we are going along. So to me, as long as you can get a vaccine that gives you coverage, especially when you are actually having active treatment or you're having active cancer, that means you're at risk, go for it, because it is about saving your life, because we do not want that disastrous effect. So just get whatever that you can get. So get it.
Excellent. I love that answer. So basically get whichever that you can get. One thing to note to everybody out there is I think cancer patients, we are very cautious with giving live vaccines. I mean, this is what I remember from medical school days, but none of the COVID-19 vaccines are live. So in that sense, even though there are certain studies for the various vaccines that you've just mentioned, none of them are live. So I think if you're worried which is better than the other, there's nothing at the moment that's better than the other. So it's still safe to actually just get the Pfizer or the Sinovac, whichever is given to you at the moment. Excellent, yeah. Excellent. So what about cancer patients on treatment? And given, like, okay, so just say they've got the Pfizer or whichever vaccine that they've got, the 2-dose vaccine. So after completing their 2-dose regime, would they mount the same amount of antibody response as a normal person, or do you see a less antibody response? What is your take on that?
Okay, I think the timing of giving the vaccine is very important in cancer patients. So if they are having chemotherapy that is every 3 weeks, so maybe the nadir period, which is the middle week, so that means 1 week after their chemo, that middle week is a week that their white cells are the lowest. So perhaps you can avoid that time from getting the vaccine. So a few days. Sorry, the hospital called me. I'm such a busy.
Sorry, I'm so sorry. I just realized that you were off and my phone was on mute, so everybody couldn't hear what was going on and you had a call
The
in
hospital
between.
called me,
See,
so
that's the busy life of a clinical oncologist. I'm so sorry to everybody. So we will continue from where we were actually talking about mounting antibody response for a
yeah.
cancer patient. So do they mount the same amount
I
of
was
cancer response?
Yeah, so I was saying the timing, and then the two studies that I related to. So there were two studies done on about 300 patients. So there's one study done in New York with about 200 plus patients, then another study done in Israel about 108 patients. So in these studies, they tested the antibody response for patients on chemotherapy at the day one and then at about 3 weeks. And the results showed that about up to 90% antibody response in these patients.
Wow.
Yeah, so the 10% of patients that didn't respond, these were the hematological cancer patients who were on really immunosuppressive drugs that actually were on probably their B cells. So otherwise, the other patients, especially the solid tumors, the lung cancers, the breast cancers,
Yeah.
the GI
Yeah.
cancer, these are the ones who are able to mount response despite having 2 doses of chemotherapy while they're having the vaccine. So I'm not worried about that. And in terms of the duration of response, it can be between 6 months to a year. And people
Okay.
are already talking about boosters being given after 6 months. So yeah, so I guess we shouldn't be too worried about that.
Okay, excellent. So that's really reassuring. The fact that, even if you're on chemotherapy, minus a few group of people, but if you're on chemotherapy and you get your 2 doses of the vaccine, it does mount an
Yeah.
adequate amount of response. For me, 90% is really good. So,
Yeah, that's
so go get the vaccine. Yeah, it's really good. And I think there are ongoing local studies as well looking at the antibody boost for cancer patients also. If I'm not mistaken, there are some studies ongoing. Yeah?
yeah. I guess
Right.
I guess
What?
yeah. Another thing is actually 90% is high, but I guess even if you get 50-60%, that's good enough, don't you think so? Because
Yeah.
yeah, any
Yes.
it's good
Something
for
better than
protection,
nothing.
even if you
Yes,
yeah, right.
exactly.
Yeah,
Yeah.
you're right.
So what about the vaccine interacting with the chemotherapy? Do they cause maybe your chemotherapy not to work as well? Like some are worried that, oh, it's going to interfere with my treatment, and maybe I should finish my treatment and then get my vaccine. So does it affect or interact or make their chemotherapy less effective or radiotherapy less
I,
effective?
I That's actually a very good question, because I also would like to ask my patients that, because they insist on taking all the alternative therapies and while the chemo, and now they're all, the vaccine is gonna, you know, uh,
Yeah.
there's no study to actually show that, we are still a bit early on. I mean, if we want to know about whether it interferes with the treatment or not, we are looking at somewhere beyond this. But I guess if
Mm-hmm.
you have, if you have cancer, and we know that cancer is best when we treat it early, the same way with COVID-19 is best if you can prevent it, or if best if you can actually, subdue it, make it less severe by getting the vaccine. So in a way, you win two battles without having to, worry too much. Don't overthink.
Yeah.
Just do. Yeah.
Absolutely. So what about there are some patients who've had, like, especially for breast cancer. So I know a few in my family who've had breast cancer and they have had lymph nodes removed, so what we call axillary clearance, or lymph nodes, part of their lymph nodes have been taken off. So what about these patients? Can they get vaccinations on the same arm, a different arm? Because here when you go to the vaccination center, they just go, okay, show us your left arm, the non-dominant arm, and we're just going to inject it there. But some cancer patients may have had their lymph nodes removed from that particular arm. So do they have the right to get the vaccines on the other arm, or what's your take on that?
Okay, so if the patients have had an axillary clearance surgery, that means that they have removed a lot of lymph nodes from their armpit, right? We prefer not to meddle with that arm, because we do not want you to get cellulitis, which is an infection underneath the skin. And perhaps if you already have lymphedema, then maybe the cellulitis will make it worse. And because we do not know how everybody is going to react to the vaccine, so since there's the other arm to use or there's the tie to use, then
Yeah,
use it. So the
absolutely.
people like the vaccine centers also have to be sensitive and has to be flexible and not to adhere to some rigid rules that is
Yeah.
not on stone anyway. So yeah, so I don't think that's a big concern at all. So go for the vaccination, let them know, and maybe you can also educate them that there's such a thing as
Yes.
avoiding the arm for any kind of prick. Yeah.
Yes, correct. So someone, I think Dr. Ravin put in the comments that there was a recent study showing post-vaccination PET scans showed enlarged lymph nodes. So yeah,
Yes.
I have seen a few studies that showed lymphedema post-vaccination. So I think it's best if you don't inject the arm that you had your axillary, your lymph nodes cleared, because if you do get lymphedema, then you're not sure whether it's recurrence or, and you don't want a cancer patient or a cancer survivor to go through that sort of thing all over again. So just do it on the non-dominant hand. You have all the right to just tell them that you want to do it on the hand, or even if you want it on the thigh, I think that's absolutely fine. So yeah, so thank you for answering that. So what about patients with now we call variant of concern, right? So variant of concern and immunocompromised patients. I know you had some interesting things to tell me the other day. Would you like to talk about that a little bit?
So actually, what I have read is that for patients who have cancer, if they are immunocompromised, and cancer patients are immunocompromised just because of their disease and also because of their treatment. So if they are immunocompromised and they get infected with the virus, right? And they go all around with very little symptoms because they're not able to probably mount any response to the infection, and they get to actually eliminate the virus a bit later than other people. And while they are actually going around with the virus, they are going to become somewhat like a vector. So they are actually going to transmit a virus that has been living in their body a bit longer, and they become what we call variants. And therefore, like I said, it's not probably not good to say a human being as a vector, but that's how I look at it. That means the cancer patient would become someone who actually going to give rise to a lot of variants of the virus. So that's very, very scary to think about. And
Yeah.
then that's why it's very important that we vaccinate the cancer patients, because we just do not know, how all this is going to emanate into something more serious than what we already know.
Absolutely, So I think there are higher chances of an immunocompromised cancer patient actually becoming the vector for all these variants of concerns, So we don't want more variants when we can actually vaccinate the immunocompromised patients. We have another question in the comment section by Jahangir. Is there a need to monitor cancer patients on active treatment post-vaccination?
Okay, the cancer patients who are on active treatment, their treatment is not going to be on the same day as the vaccination. So I guess because
Oh, no.
monitor them, because as long as they don't have any, a history of severe allergy or autoimmune condition, blood clots, just like other patients, there's no need for us to actually monitor closely or longer at the vaccination center. I don't think so. I mean, we have had so many patients being vaccinated, they are fine,
Okay, so he even wrote here, perhaps admission for a day. I think the risk of admission is even more higher to contract COVID. So it's best if you stay in the safety of your own home. So I think that's the best. So no reason to, and I think if you're worried about fever and everything post-vaccination, there are ways that the oncologist can also determine whether this is a fever because of an infection or whether this is a fever because of a post-vaccine sort of reaction, which usually don't last more than 2 or 3 days.
Thank you.
I think that was,
Because
sorry?
this matter about fever after chemotherapy and having vaccination was also highlighted the other day, because you know, if you have fever from the chemotherapy because of febrile neutropenia or neutropenic sepsis, then we have ways to actually confirm that. So do not worry about, you know, getting the vaccine after your chemotherapy and the fever will make you confused or something like that. Do not worry about that.
Absolutely. You know, I mean, there's so many ways that we can actually know what is actually going on. So if you're so concerned about the side effects, I think also just talk to your oncologist, your own oncologist, because everybody's body is different, and whatever cancer you may be going through. I mean, not all of us are Dr. Mastura's patients, you know, so if you are other oncology, you have other oncology follow-ups, please discuss with your own oncologist to determine the best time for you to get the vaccine. And some cases, we do give the vaccine in a hospital setting rather than you know, a vaccination center nearby to you. So I think that's all on my side. So are there any tips or messages from cancer patients for the vaccine? Do you have any last messages for them, Dr. Mastura?
I think the message that I want to tell them is actually to go for it. They are, you know, try to get hold of the vaccine, however, and you know, whenever you can. Yeah, it's available there out there, and you know, just grab it. That's basically what I want to tell them. And second is actually, sometimes we don't have the choice of choosing what vaccine to have, and therefore just grab whatever that you can grab, so that you can be protected at least in the next 6 months or so.
Yeah, absolutely. Well, thank you so much, Dr. Mastura. I think that clarified a lot of my doubts as well, and reassured me to advise even my colleagues and my friends who are undergoing the same, who are undergoing all these things at the moment. So thank you so much, Dr. Mas. I won't take up too much more of your time. I'm so sorry for the glitches in between, everybody. Dr. Mastura is very busy, so she had a call coming in between. So if you want to rewatch the whole thing, just check out the IGTV. Just fast forward the part where we lost out for a bit, and you can always just listen to the rest of it. So thank you so much, Dr. Mastura, once again. If you have any other questions, do DM me, and I will make sure that I get them answered for you as well. Thank you so much, everyone. Take care. Bye.